million people in the United States suffer from superficial venous reflux disease, a circulatory condition that causes varicose veins. Dr. Jonathan Calure is a board-certified cardiovascular surgeon, and he's here from Maryland Vein Professionals to give us more information. Now, Dr. Calure, what are varicose veins? Where are they coming from?
Varicose veins are commonly known as those veins that appear at the skin surface just below the skin, the big, ropey, bulgy veins. Can also be the spider veins, too.
And is this like a cosmetic or a medical problem that people are dealing with?
Often it's a circulatory condition or a medical problem that produces a cosmetic issue. It's not primarily a cosmetic problem.
Are there signs that you should actually get this checked out by a physician?
Usually if there are symptoms present, that should be checked out. Achiness, tiredness, swelling, edema, restless legs can be common symptoms.
So not just the appearance.
Often it presents as a cosmetic issue and the symptoms kind of creep up on the patient. So it takes many years, but yeah, symptoms that I mentioned, yeah.
So what can we do to get rid of them?
Well, it's important to be evaluated and see what's causing the veins. In many patients, there's a deeper pressure source that's pushing out, sort of a leaky pipe below the surface that's letting pressure push to the skin surface. If that deeper source is never addressed, then the skin veins will never clear.
So how can we address that?
Well, we do a treatment called the venous closure procedure, which uses RF energy to ablate the leaky pressure source.
Okay. Are there other treatments? Is that the main one that you recommend? Or?
Well, we focus on treating the medical condition. We treat the pressure source first, and then we can move to the skin surface and do the more superficial or cosmetic things as well.
And what are those?
Well, commonly at the skin surface, you treat with sclerotherapy, a treatment where medicine's used to inject the veins. It has the effect of a pencil eraser. Sometimes you can use laser photoablation. But it's important to address the underlying pressure source first, or you won't have good results.
Okay. And those services are all available at your office?
Sure.
Are any of these services covered by insurance?
The venous closure procedure is covered by most insurances. It treats a medical condition.
Okay.
And to see if that's appropriate, we have to scan with ultrasound.
And how long do these procedures take? What can patients expect? Is it painful?
The actual light treatment, the RF ablation treatment, takes about 2 minutes.
Wow.
Folks are in and out of the office in about 90 minutes with return to normal activity, and most patients do not have too much discomfort. You can see it on my website, the comments that we have.
Wow. So once you were to do the RF, some of the more cosmetic procedures that you would then do, how long do those procedures usually take? Many treatments?
Well, first I normally tell my patients to wait at least 6 weeks after we do the medical treatment before we look at doing anything cosmetic, because sometimes those will fade. And then we don't rush it. When we start sclerotherapy, for example, we say no more than 1 treatment a month.
Okay. And is that painful?
It can be pinchy, but it depends on the patient, it depends on the provider, but we're usually pretty good about that.
How can what should one look for in a provider? Is this, I've seen it offered at many different places where they offer sort of multiple across-the-board services. It looks like you all actually specialize.
Right, we do exclusively vein. We approach it from a medical standpoint. This really is a medical condition. It gets undertreated, really. So if you focus on cosmetics, you're not going to have good results. We start with the medical cause, and then we work from there. That's what makes us different.
For a complimentary screening at Dr. Calure's office, you can call 410-964-VEIN or visit mdveinprofessionals.com for treatment results and patient testimonials. Next, learn what new technologies are being developed in cosmetic surgery on Make Me